It can be said that women have held the world together in 2020. The following session will focus on the next logical question. Will they have a fair shot at shaping the post-COVID society? Specifically, how can women leaders shape pandemic response, and how can governments and the private sector take action, including in the area of childcare, where women take on the majority of work? Please welcome conversationists Melinda Gates, Sanda Ojiambo, Shailaja Teacher, and Nancy Kacungira for this important discussion.
Hello and welcome wherever you're watching from. It's wonderful to have you joining us for this very important conversation about women after the pandemic. Now, 2020 has been a taxing year for everyone, but the impact of the response to this pandemic on women and their lives all around the world has, in some cases, had devastating effects. Women have really stepped up and helped to keep the world together in this difficult time, everything from childcare to healthcare to national leadership. But just how much say will they have in shaping the world after the pandemic? That's one of the key questions that my two guests today are very well placed to answer and give insight into. I'm joined today by Melinda Gates, co-chair of the Bill and Melinda Gates Foundation. She, of course, is setting the direction and priorities for the world's largest philanthropy. Also joined today by Sanda Ojiambo, the Executive Director of the United Nations Global Compact, and that's a UN initiative that is steering businesses towards achieving the Sustainable Development Goals. But before we get to our conversation, I'd like you to watch a message from a woman who has a couple of nicknames. Her name is Shailaja Teacher. Now, teacher is one of her nicknames given to her because she used to be a science teacher. She is currently the Minister of Health and Social Welfare for Kerala State in India. And she recently earned herself another nickname, the Coronavirus Slayer. And this is because of her incredible contribution towards preventing the spread of coronavirus in her state. Let's watch this clip from her now and hear what she has to say about the role that women have played in fighting COVID-19.
The grassroots level workers involved in fighting the pandemic in frontline is predominantly women. This includes over 66,000 women workers in the field level belongs to Women and Children Department. And more than 27,000 field level workers belongs to Health Department. And also 4.3 million self-help group workers called Kudumbashree, which also belongs to government. Moreover, more than half of the local self-governments were led by women leaders here. And they have led the fight against the pandemic, exploring all the opportunities and fighting all the challenges of governance and administration. In addition, 9 out of my 14 district medical officers were women. I hope that in the post-COVID era, this would reflect as more opportunities for women in all aspects of building a new world. Thank you.
So we've heard there from Shailaja. She is the Minister of Health and Social Welfare in Kerala State, India. And I must mention, she's on a list in this month's edition of Vogue India of the Women of 2020, because her contribution to the response to this pandemic has just been so huge. Now, Melinda, if you can start by setting a stage for us in terms of what you think about the way this pandemic has impacted women, because I saw something that you echoed when you said this pandemic might be gender blind, but it's not gender neutral. Just tell us a little bit about that.
Well, we know that COVID has exposed all of the cracks in our society. It's not just affecting our health, it's affecting our economies. But we're starting to see, finally, it's in our face, the racism and the sexism that's in society. And so women's lives and livelihoods are being drastically, for instance, affected. They're losing their jobs, at twice the rate that men are. And so when we look at this pandemic and we look at how are we going to get through it and how are we going to build back, we have to have women with seats at the table. 70% of our frontline health workers around the world are women. And yet, if you look at these COVID task force, the WHO's emergency task force, 20% of the leaders on that are women. If you look at our current COVID response in the United States, 10% of the task force is women. Now, the new administration is going to get that up to 40%. But what we know is that women have a holistic view on society. As the minister just said, they are the ones who are out, who are living the frontline work, who are out doing the grassroots work. So we need their leadership at the table to figure out how to get through this pandemic in the best possible way for everybody.
And Sanda, just picking up from that and thinking about where we find ourselves today, is there a chance that we've actually gone backwards? Because as Melinda hinted at, there is that very gnarly fact we have to deal with, that women are dropping out of the workforce at a faster rate than men. So with this pandemic, are we actually going backwards?
Thanks, Nancy. And I just really want to echo Melinda's comment that certainly the pandemic has not been gender neutral. As has been said, women have been at the forefront of the response. But if we just go a notch deeper and look at the other impacts that COVID has had, look at education. At a time when for most of the world, those who could shifted to digital learning, in a world where already women and girls were marginalized from education, think about the double effect of that, where there's also no technology. I think firmly millions of young girls and women have had educational opportunities simply shut down or cut short because they weren't able to jump onto this digital age occasioned by COVID. And certainly in the economic front, women drive the backbone of the SME sector, and across the world, millions of SMEs shut down, millions of workers lost their jobs at this point in time. So not only did we have the dual effect of women being upfront as nurses, caregivers, and store clerks and all of that, but at the same time, many women fell backwards. And I think this has been said at the global level, looking at the Sustainable Development Goals. We started off a decade of optimism, the decade of action for the Sustainable Development Goals. But sadly, COVID has slowed down much of that progress. And so the rebuild and, building back forward really has to take cognizance of all of the inequalities that have arisen and the gender gaps that continue to exist around the pandemic.
But Sanda, what's your pushback to businesses that say, well, this is about practicality? In a situation where women are earning less in a household, they may be the ones who have to drop out in order to look after the children. This is an unprecedented situation. Some of these are practicalities. What are the things that we could do to take away some of those arguments that actually push the issues that affect women to the periphery?
Yeah, what I'd say is I think that the pandemic has given us a unique opportunity for reflection, for a reset. And what it has shown us is the fragility of business as a whole. And a lot of that fragility has been occasioned by the fact that decisions have been made that were never inclusive, that were never sustainable to begin with. And I think if businesses really do want to look at a long-term future, it is time to take into consideration a lot of that. Inclusive business decisions result in inclusive outcomes. And it really is time to move that forward. I think a lot of the unpaid work that women does really does need proper compensation. We need proper safety nets for society. We do need proper childcare. We need to ensure there's proper education. But more importantly, I think we need a really good review, as a lot of the economic stimulus packages are being debated and deployed, to really look at how these packages will be inclusive. And that inclusivity must have gender and women at the center.
And Melinda, I'm interested in what conversations you're having about the implications of this for areas like healthcare and childcare. If we look back to the Ebola outbreak between 2013 and 2016, some lessons to be learned there perhaps, because the death toll for mothers and babies who weren't able to access proper care during that time was actually just a little bit higher than the number of people who died from Ebola itself. So how do we avoid replicating some of those fallouts with this pandemic?
Yes. So what we've learned from the Ebola pandemic in the four affected countries in Africa was that you get these shadow pandemics that go alongside of it. So you get increased domestic abuse because more people are at home. You get more maternal mortality because women don't go to the healthcare facility. They're afraid to go for good reason. So we can look at all these knock-on effects for women, and we can take action now. You're seeing the world come forward and say, these are our domestic violence numbers now. In Paris, they set aside grocery stores and pharmacies as places that women could go and report domestic violence. Canada set aside hotel rooms. You saw other countries say, hey, we're going to have shelters women can go to if they were in Africa. So those are some things you can do on the domestic violence front. On the health front, you see countries like Ethiopia saying, okay, women aren't going to feel comfortable coming into the health system, so we're going to make sure they get clean home birth kits out to them and to the traditional midwives so we can get ahead of this. So that would be my response on the health front. But the other issue you raise, which is enormous, is, as Sanda said, the unpaid care work that women do. We need to recognize as a society that all of our economies around the world are built on the backs of women's unpaid labor. And so we have to look at that. There are 1.5 billion children out of school right now, and that work is disproportionately being borne by women. That's why they're dropping out of the workforce. That's why when the jobs do become available, they're not going back in as quickly as men. So there are things we can do. Governments can make sure there are robust paid family medical leave policies and early childcare provisions. Businesses can make sure there are flexible work hours and paid family medical leave. And media and businesses can also, in civil society, change the norm about what's expected between work and childcare. We care about our children and we want to work to have income. We need to balance society and make the norm that all of this work doesn't just go to women.
And I suppose a question that follows on from that is, what comes first? Is it the policy, or is it a change in attitudes that needs to shift? I remember seeing at the start of the pandemic, when all this panic buying was starting to happen, one of the popular tweets was someone saying, oh, I can't find toilet paper because Susan and Karen have stocked all of it, for the next 20, 30 years. And even there's an implicit, an implicit message that it's the women who do the shopping. It's the women who do the caring. They're the ones who are going to be looking after the elderly who need care. They're the ones who are going to be looking after the children. So is it a matter of changing attitude before policy, or do these need to happen at the same time?
I would say for sure at the same time. And that's why, as Sanda has indicated, and as the minister who was on video earlier indicated, you must have women at leadership places at the table. They will make those changes. They will say, no, make this policy change. And by the way, I'm a leader, just like we're going to have a future female vice president who's of color in our country. Young girls can look up and say, hey, that's a norm change. I've never seen a woman in a vice president role. You can do both at the same time, but women have to have those leadership positions to help us make those changes and even make the changes in our media messaging.
And Sanda, if we pick up from that, there was a little bit of talk about the countries that had women leaders doing better in terms of managing coronavirus. People were pointing out that countries like Finland and Germany that had female leaders, in New Zealand, seemed to have a more caring and cautious approach to leadership. Now, obviously, we don't want to generalize based on the actions of a few extraordinary leaders in extraordinary circumstances, but does this tell us something about the kind of society in which women can rise and the kind of outcomes that you can have because of that?
Yeah, and I'll pick up on that and just really go back to the question about inclusive decision making and the results that come out of that. I think results have shown, in the business sector, that when women are at the decision making table, outcomes and decisions certainly are different. And I do think that there is a reason and a rationale for having strong leadership, and strong leadership is not made of just one gender. And I think certainly this COVID pandemic has shown us some great examples of female political leadership, female business leadership, and female community leadership that has resulted in immense success and transformation in and through COVID. Now, what I hope for is that we saw this in a pandemic situation with a lot of urgency around it. But this is something that we need to embrace and do every day. I'll just go back to my point. Having inclusivity really does result in different outcomes.
Why? I'll just push back on that a little bit. Why has this not happened yet? Because we seem to know these things in theory, but in practice, it sort of falls apart. Why don't businesses have more women leaders?
Well, some of this is structural, some of it is cultural, some of it is the factors that Melinda said. Even when an opportunity does exist, a woman is not able to take it up because she has domestic work, she may be trying to pursue a job and study late night to get a necessary degree or a qualification. We just need to take cognizance of the fact that there's a number of factors that are structural barriers to perhaps getting women at the table, but all those barriers can actually be dismantled with a firm and concerted effort around it. Some of it requires policy examination, but some of it is actually very practical business decisions that we all need to make. And I think I'm glad to be in an organization that aims to challenge some of these orthodoxies through principles, through partnerships, and just demonstrating the best that we have in business leadership.
So these fault lines that have been exposed by the COVID-19 pandemic, Melinda, you call yourself an impatient optimist. What's sparking optimism in you with regards to what the COVID-19 pandemic can teach us about the role that women are playing in our lives?
Well, one thing about this pandemic is it is in our face. We are home. We are all home. We're not out, working in society the same way we were before. And so this unpaid labor is right here in our faces. And whether you talk to male congressmen or senators or female ones or members of parliament, they all see it. The global leaders see it because it's in their homes. Somebody has to help the kids with their schooling online, make sure the laundry gets done, make sure the kids are fed. So if we can look at this moment and say, instead of saying that these gender issues are nice to do or sideline issues, they are not. They're the crucial issues. And I am optimistic because the pandemic has exposed this. We can't turn away from it. And if we're going to build society back, we're going to have to take advantage of this opportunity and say, no, gender is front and center. And the Generation Equality Forum that's going to happen in June of 2021, is 25 years on since the forum where Hillary Clinton said, women's rights are human rights are women's rights. That is going to be our moment. And so if these action coalitions come together, particularly one of them on economic justice and rights, that's a place you can take up childcare and talk about unpaid labor. And what I'm optimistic about is people coming together, civil society, the private sector, and government. I will do this with our foundation, say, what specific commitments can we make on behalf of the world to build back better? Because in my view, equality cannot wait. This is our time, and this is our time to put it front and center and not say it's some nice to do issue. And we have the data finally that shows us that it's not a nice to do issue. Sanda talked about it a bit in business. We see it in the private sector, but we finally have the data now to make our argument and make the case so that we make the right economic investments and policy decisions.
Mm-hmm. And what about you, Sanda? What do you feel that you can do within your organization and that others can do, businesses specifically? One of the refrains in this time has been listen to the experts. How do we make sure many of those experts are women?
First, I want to broaden the notion of who an expert is. As Melinda said, we are all at home now. Who is the expert in domestic issues? I think, if anything, everything is being spread by everybody. Kids get the chance to see parents at home probably doing roles that they probably never saw traditionally at this point in time. I think the expert is the person who is committed to delivering a better future. And those exist at multiple levels. They exist at community level. There's fantastic community workers who are really driving driving forward great transformation work, they certainly do exist in business. And what our commitment is to really ingrain key principles around gender equality in business and make sure that we can grow those principles through our footprint across the world. As Melinda said, equality really cannot wait. And this is truly the chance to have that step change in the way businesses has viewed the gender discussion. Also taking a very broad look at gender. It's not just having women around the table, it's what they do at the table. It's a type of conversations they can have at that table and the shifts that they can make. So we're looking for, optimistically, some holistic changes in the roles of business and the roles of women in business.
I think that's a great reminder that what's good for gender equality is good for the economy, is good for society in general. And women aren't just victims of a broken world. They can be the architects of the world after COVID-19. Thank you so much to both of you, Melinda Gates, Sanda Ojiambo. It's been great to talk to you.
Thanks for having us, Nancy.